Every 23 minutes, someone in the United States is diagnosed with ovarian cancer. And no, that's not a typo. What's even more alarming is that nearly 70% of women fail to recognize the early warning signs. That means the majority are diagnosed at a later stage, when treatment is far more difficult and outcomes are less hopeful. But here's something most people don't realize. When ovarian cancer is caught early, the 5-year survival rate jumps dramatically, from around 30% to over 90%. That's not just a number. That's the difference between hope and heartbreak, between early intervention and late regret. As a healthcare professional with over a decade of experience working alongside women of all ages, I can tell you, these signs are often silent, subtle, and easily brushed off. A little bloating? Maybe it's your diet. Feeling tired all the time? Probably stress. Frequent urination? Just aging. I've seen far too many women ignore these signs until they couldn't anymore. In this video, I'm going to walk you through 8 early symptoms of ovarian cancer that you should never ignore, not even for a day. We'll break down how these signs show up, why they happen, and what to do if you notice them. And stick around, because when we get to sign number 6, you'll understand why so many people mistake it for something ordinary, when it might be the body's biggest cry for help. If you find this information helpful, or even eye-opening, please like this video, subscribe to the channel for more life-saving insights, and share your thoughts or personal story in the comments. It might just give someone else the courage to listen to their body and act in time. Let's get started. 1. Persistent bloating. Let's start with one of the most common, but dangerously overlooked, early signs of ovarian cancer: persistent abdominal bloating. Now, let me be clear, occasional bloating happens to everyone. It could be from a salty meal, hormonal changes, or digestive issues. But here's what makes cancer-related bloating different. It lingers. It builds gradually over days or even weeks, and no matter what you eat or avoid, it just doesn't seem to go away. As someone who's worked with countless women in clinical settings, I can tell you that this is one of the most misinterpreted symptoms I see. Many patients think it's just gas or water retention, when in reality, it's the body responding to fluid buildup in the abdomen, a condition called ascites, which is often caused by tumors irritating the lining of the abdominal cavity. You may start noticing that your pants feel tighter around the waist, even if you haven't gained weight. Some describe it as a firm fullness that makes them feel heavy or pressured, especially when lying down. And unlike regular bloating, this doesn't respond to dietary changes, probiotics, or over-the-counter meds. One red flag I always mention to my patients: if your bloating is constant, not linked to meals, and you feel it every day for more than 2 weeks, it's time to check in with your doctor. Because early detection could make all the difference. Keep watching, because in the next sign, I'll share a subtle eating pattern change that often gets dismissed, but could be your second clue that something deeper is going on. And if this already sounds familiar to you or someone you care about, drop a comment below. Your story could encourage someone else to speak up and get help in time. 2. Early satiety. Let's move to the second sign, one that's often misunderstood, yet incredibly telling: early satiety, or feeling full too quickly when eating. Now, everyone has days when they lose their appetite or fill up faster than usual. But when this becomes a pattern, especially alongside other subtle symptoms, it may point to something more serious happening in your abdomen. From my experience working with women across different age groups, I've seen how this symptom can slip under the radar. You might find yourself unable to finish a meal you've always enjoyed, or notice that just a few bites leave you feeling uncomfortably full. Sometimes, this sensation is accompanied by mild nausea or a persistent pressure in the upper abdomen. Many of my patients describe it as if their stomach doesn't have room to expand, even when they haven't eaten much. Why does this happen? Well, when ovarian tumors begin to grow, they can press against nearby organs, including the stomach. This pressure reduces the stomach's capacity to stretch, leading to that early, uncomfortable feeling of fullness. And unfortunately, this often leads to unintentional weight loss, since you're not eating enough to nourish your body properly. If you've noticed yourself skipping meals, eating less without trying, or even avoiding food because of discomfort, don't brush it off. It's not just stress, and it's not aging. It's your body asking you to pay attention. Up next, I'll talk about a symptom that many women confuse with simple overhydration or bladder issues, but that could actually be a sign of internal pressure from something far more serious. And if this symptom of early satiety sounds familiar to you or someone you love, please share it in the comments. Your experience might help another woman take action before it's too late. 3. Urinary changes. Let's talk about the third symptom, one that's often dismissed as just drinking too much water or part of getting older: frequent urination. On the surface, it doesn't seem alarming. But here's what I've learned over the years in clinical practice. When women start planning their day around access to a bathroom, it's time to dig deeper. You might find yourself waking up more than once a night to use the restroom, or feeling a sudden, urgent need to go, sometimes with barely any warning. Even after urinating, you may feel like your bladder isn't quite empty. These changes might start subtly, but they tend to become more noticeable over time. So what's the connection to ovarian cancer? When a tumor begins to grow in the pelvic area, it can press against the bladder. That pressure mimics the sensation of needing to urinate more often, even if the bladder isn't full. This symptom is particularly tricky because it's often mistaken for a urinary tract infection or a natural part of aging. But unlike a UTI, there's no burning, fever, or relief after antibiotics. And unlike normal aging, this change tends to be persistent and progressive. Some women even avoid drinking water to reduce trips to the bathroom, which ironically can worsen fatigue and other symptoms. If you've noticed a sudden increase in urinary frequency, especially if it's paired with bloating or early satiety, don't ignore it. These aren't isolated problems. They often point to something deeper. In the next part, I'll talk about a type of fatigue that feels very different from just being tired and could be one of the earliest red flags your body gives you. If any of these signs are sounding a bit too familiar, share your thoughts in the comments below. Your voice could be the reason someone else takes their first step toward early diagnosis. 4. Fatigue. Now let's talk about a symptom that most women chalk up to a busy life, stress, or aging: fatigue. But the kind of fatigue associated with ovarian cancer is not your average tiredness. As someone who has spent over a decade listening to women describe this symptom, I can tell you, it's a completely different kind of exhaustion. This is not the kind of fatigue that goes away after a nap or a good night's sleep. It lingers. It weighs on your body like a fog that doesn't lift, no matter how much rest you get. You may start to notice that even simple tasks, like making breakfast, folding laundry, or walking across the room, suddenly require more energy than usual. You take more breaks, sit down more often, and yet, you still don't feel refreshed. What makes this particularly important is that fatigue tied to ovarian cancer often appears alongside other symptoms, like early satiety, bloating, or unintentional weight loss. Your body is working overtime to manage an internal problem, and that constant effort depletes your physical and mental energy. Some women describe this as a kind of whole-body heaviness, while others mention losing motivation for things they once enjoyed. It's easy to blame this on age, hormones, or stress, but when this type of fatigue shows up and stays, it deserves attention. So if you've been feeling increasingly drained, especially if you're sleeping more but still waking up exhausted, don't just push through it. Listen to your body. Coming up next, we'll explore a type of pain in the lower abdomen or pelvis that many women overlook but can signal something far more serious. And if fatigue is something you've been quietly struggling with, leave a comment below. You're not alone, and your experience could help others recognize the warning signs early. 5. Pelvic or abdominal pain. Let's move into the 5th warning sign: pelvic or lower abdominal pain. This symptom is often brushed off as menstrual cramps, digestive issues, or just another part of being a woman. But persistent discomfort in this area, especially when it doesn't follow a predictable pattern, can be your body's way of waving a red flag. In my years of practice, I've seen many women normalize this pain for far too long. At first, it might feel like a dull ache in your lower belly. Some describe it as a pressure, others as a sharp twinge that comes and goes. But here's the difference: it doesn't align with your cycle, and it doesn't fade away over time. In fact, it often grows more noticeable during daily activities like walking, bending over, or even trying to sleep comfortably at night. This pain may even radiate to your lower back or thighs, making it harder to pinpoint. And unlike temporary discomfort from ovulation or digestion, this kind of pain persists for weeks or months, gradually interfering with your ability to go about your normal routine. Over-the-counter medications like ibuprofen or heating pads may dull the sensation temporarily, but they don't provide lasting relief. That's because this discomfort often stems from the presence of growing ovarian tumors, which can stretch nearby tissues and apply pressure on surrounding organs. It's important to note, any pelvic pain that is new, lasts more than 2 weeks, or gets progressively worse should never be ignored, especially when it's paired with other symptoms like bloating or fatigue. In the next section, we'll take a closer look at a specific type of back pain that behaves very differently from everyday strain. And if pelvic pain has become part of your normal, take a moment to comment below, because normalizing pain is one of the biggest reasons ovarian cancer goes undetected for too long. 6. Lower back pain. Let's talk about a symptom that many women dismiss as a posture issue or just part of aging: persistent lower back pain. Now, back pain is incredibly common, especially for those of us who sit for long hours or carry heavy loads throughout life. But the kind of back pain that may signal ovarian cancer is different. It's deeper, more stubborn, and doesn't respond to the usual fixes. What I often tell my patients is this: if your lower back pain feels like it's always there, even when you're resting or lying down, and if it gradually worsens over time, you shouldn't ignore it. Unlike a pulled muscle or poor sleep position, this discomfort tends to spread from your lower back to your pelvis, and sometimes even down your thighs. It can make everyday movements, like bending, lifting, or even standing, more difficult than they used to be. One of the key differences I've seen in clinical practice is that this kind of pain doesn't ease up with stretching, heat therapy, or a good night's sleep. That's because the pain isn't muscular. It may be caused by pressure from growing tumors in the pelvic cavity, pressing on nerves or ligaments in the lower back. This pressure leads to inflammation and tension that just doesn't go away. If you've been living with this kind of back pain and it's not improving, or worse, getting gradually more intense, especially in combination with other symptoms like bloating, fatigue, or pelvic discomfort, it's time to get it checked. In the next part, I'll talk about a lesser-known digestive signal: changes in your bowel habits, a symptom that many people overlook, but your gut may be trying to tell you something serious. And if you've experienced this type of chronic back pain, leave a comment below. Your voice may help another woman recognize what her body is trying to say. 7. Bowel changes. Now let's look at the 7th warning sign: changes in bowel habits. This one is particularly tricky because it's often attributed to diet, stress, or age-related digestive issues. But as someone who's worked with countless women navigating vague symptoms, I can tell you, when your gut starts acting differently and stays that way, it's time to pay attention. You might notice yourself alternating between constipation and diarrhea, even though your diet hasn't changed. Or you might experience a constant sense of incomplete bowel movements, as if something is blocking things from fully moving through. Some women feel a sudden urgency to go, while others struggle with control. And despite trying fiber, probiotics, or eliminating certain foods, the pattern doesn't improve. That's your sign that this isn't just IBS or a reaction to what you ate. So what's happening here? As an ovarian tumor grows, it can apply pressure to the intestines, disrupting normal digestion and bowel function. That physical pressure changes how your bowels work, sometimes mimicking gastrointestinal conditions. But unlike typical GI issues, this change is persistent, unexplained, and often paired with other red flags, like bloating, pelvic pain, or fatigue. One thing I always tell my patients: if your digestion starts behaving differently, and those changes last for more than 2 weeks, even with dietary adjustments, it's worth bringing up to your doctor. Early evaluation could make all the difference. In the next section, we'll talk about menstrual changes, something many women brush off as hormonal shifts, but that might actually be your cycle trying to tell you something more. And if you've been living with unpredictable digestion that doesn't seem to go away, let us know in the comments. You're not alone, and your voice could help another woman get diagnosed sooner rather than later. 8. Menstrual changes. Let's talk about the 8th sign: menstrual changes, something many women notice, but often brush aside as stress, age, or just hormones. In my years of working with women's health, I've learned that your menstrual cycle is often one of the first areas to reflect that something deeper may be going on. You might experience heavier or lighter periods than usual, or your cycle could become irregular after being predictable for years. Some women notice spotting between periods, while others find that their premenstrual symptoms feel more intense or different than usual. These changes can creep in gradually or hit all at once, but the key is, they don't resolve over time. Why does this happen? As ovarian tumors grow, they may disrupt hormone levels or create inflammation in nearby reproductive tissues. This can affect the regularity and quality of your periods, even if you're not yet in perimenopause. I've had patients in their 30s and 40s tell me they felt something was off, but didn't want to overreact. Unfortunately, waiting often means a delay in diagnosis. You might also notice your periods becoming longer or shorter, or feel pelvic pain that's worse than usual during menstruation. Your usual menstrual products might not work as well anymore due to a heavier flow, or you may suddenly need them more frequently. If these changes persist for more than 1 or 2 cycles, especially when combined with other symptoms like bloating or fatigue, it's time to check in with your doctor. Up next, we'll cover the last warning sign, one that often gets confused with common back strain but could point to something more serious. And if you've experienced unexpected menstrual changes lately, share your story below. You never know who might see your comment and finally take their symptoms seriously. Now that we've walked through these 8 early warning signs of ovarian cancer, let's take a step back and reflect. These symptoms, on their own, might seem minor. A little bloating, some back pain, or a change in your period. Life gets busy, and it's easy to ignore them. But as someone who has worked with hundreds of women over the past decade, I can tell you this: your body whispers before it screams. And recognizing these whispers can make all the difference. Here's a quick recap. Persistent bloating, feeling full too soon, early satiety. Frequent urination without a clear reason. Ongoing fatigue that sleep won't fix. Pelvic or abdominal pain that lingers. Lower back pain that's deep and doesn't improve. Bowel changes without dietary triggers. Irregular periods or unusual spotting. If one or more of these symptoms sound familiar to you, please don't put it off. Call your doctor. Ask questions. Request tests if necessary. Ovarian cancer is highly treatable when found early, but it rarely shouts. It waits in silence. Speech balloon: have you or someone you know experienced any of these symptoms? Share your story in the comments below. You might help another woman recognize her warning sign. Thumbs up if you found this video valuable. Give it a like. Bell, and don't forget to subscribe. We share life-saving health insights every week. Because when it comes to ovarian cancer, early awareness isn't just helpful, it could save your life. Take care of yourself. You matter. You are not alone.